Most men don't realize that the penis ages just like the heart, the brain, or the bones. And when we ignore that fact, we don't just lose physical function, we lose something deeper: confidence, dignity, and connection. Hello, I'm Dr. James Carter. I'm a board-certified urologist and professor of men's health with over 30 years of experience helping older men not only preserve their sexual function, but reclaim their sense of identity and vitality. Now let me ask you something. What if I told you that the most common cause of penile dysfunction in men over 60 has nothing to do with aging itself, and everything to do with daily habits that we were never taught to pay attention to? And what if you could start changing that today without medication? In this video, I'm going to walk you through 5 essential ways to care for your penis after 60, all backed by science and tailored to the real-life challenges men face as they age. These are not gimmicks. They're real, proven strategies that can help you maintain performance, protect your health, and feel like yourself again. And if you stay with me to the end, I'll also share a powerful bonus habit, something most doctors never mention, that could help you prevent one of the most painful and overlooked conditions affecting older men. Before we begin, if you haven't already, go ahead and click that subscribe button and turn on the bell so you never miss honest, age-specific health advice made just for you. And if this message hits home, type 1 in the comments. If you think there's something I could explain better, type 0. Your feedback helps me help you. Let's begin with the first and perhaps most misunderstood part of caring for your penis after 60, keeping it active. One of the most common things I hear from my patients over 60 is this quiet, resigned thought: I guess my sex life is over now. They say it with a shrug or a nervous laugh, but underneath there's often sadness and a sense of loss they don't know how to explain. Let me be clear. That belief is not just untrue, it can actually be the reason function begins to fade. Your penis, just like your muscles, your heart or your brain, depends on use to stay strong and healthy. When it goes unused for long stretches of time, blood flow decreases, elasticity declines, and the tissues themselves can begin to atrophy. In the medical field, we call this penile disuse atrophy, and it's far more common than most older men realize. Here's the good news: it's also completely preventable. Sexual activity, whether it's through intercourse, solo stimulation, or medically supported tools like a vacuum erection device, isn't just about pleasure. It's about preservation. Think of it like stretching a muscle. If you stop moving it altogether, it stiffens, weakens, and becomes harder to use when you finally need it. Your penis is no different. Staying sexually active helps keep blood-flowing tissues oxygenated and nerves responsive. Now, I understand that for many men, intimacy may not look the same as it did in their 30s or 40s, and that's okay. The goal isn't to chase youth, it's to stay engaged in whatever way works for your body today. Some of my patients, like Mr. Ellison, a 72-year-old retired teacher, came to me after nearly a decade of sexual inactivity. He thought he was done. But after just a few months of consistent self-stimulation and pelvic floor exercises, not only did his morning erections return, but so did his confidence. He told me, "I don't feel young, but I feel like myself again." That, to me, is what this is really about. Because beyond the physical health benefits, there's a deeper layer: identity. Sexual vitality is deeply tied to how men see themselves. When it starts slipping away, so can our sense of pride, our motivation, and our emotional connection to others. So whether you're in a relationship or not, whether you're able to have intercourse or simply engage with your own body, do something. Don't go idle. Use it to keep it alive. And if things aren't working the way they used to, talk to a doctor. You might be surprised how responsive your body still is even now. Now that you understand the importance of keeping things active, let's talk about something equally critical, but often ignored. Good hygiene isn't just about being clean. After 60, it becomes a powerful way to prevent serious infections and even protect yourself from long-term disease. Let's dive into that next. This might sound obvious, but after 3 decades in men's health, I can tell you proper penile hygiene is one of the most overlooked forms of self-care, especially after 60. I've seen otherwise healthy men come into my office with redness, irritation, unpleasant odors, or worse, chronic infections, and even early signs of cancer. And it's not because they were dirty. It's because no one ever taught them how to clean themselves properly as their bodies aged. The truth is, what worked for you in your 30s or 40s probably isn't enough anymore. As we age, the skin becomes thinner, more sensitive, and slower to heal. Our immune systems also don't respond as quickly to bacteria or inflammation. That means small lapses in hygiene can lead to big consequences, especially in an area that's warm, moist, and often covered for most of the day. And if you're uncircumcised, that care becomes even more important. Under the foreskin, a natural buildup of oil, sweat, and dead skin cells called smegma can create the perfect environment for bacteria and infections like balanitis to thrive. Over time, poor hygiene can even increase your risk for penile cancer, a rare but very real condition in older men. In fact, countries like Brazil have among the highest rates of penile cancer globally. The leading cause, inadequate hygiene in uncircumcised men. The good news, prevention is simple. Here's what I tell my patients. Use warm water and a mild, unscented soap, no harsh chemicals or scrubbing. If you have a foreskin, gently retract it during your shower and clean underneath. Always rinse thoroughly, and this is crucial, dry the area completely. Moisture trapped in skin folds can become a breeding ground for bacteria. And don't forget to clean up after sex. Fluids, lubricants. Even natural body oils can disrupt the skin's balance and invite irritation. Let me share a quick story. One of my patients, Mr. Harris 68, came in with recurring inflammation. He thought it was an allergic reaction to his laundry detergent. Turned out he had been washing with scented soap, skipping proper drying, and never retracting his foreskin. After just 2 weeks of switching to gentler soap and better drying habits, the issue was gone. He told me, I didn't realize something so small could make such a big difference. But it's not just about avoiding discomfort or infection. When you take care of your body, even the parts no one sees, you reinforce your dignity and self-respect. You start walking taller, feeling more in control, and yes, even more attractive. Now, hygiene is critical, but there's another danger that men rarely talk about, and it often strikes during intimacy. Let's talk about what happens when you don't wait until you're fully ready, and how it could lead to permanent damage if ignored. This next point might surprise you because most men never hear about it until it's too late. One of the most common and least discussed causes of long-term penile damage in older men is having sex before a full erection is achieved. It may seem like a small detail, especially when the moment is intimate or spontaneous, but forcing penetration with a semi-erect penis can lead to micro-traumas, tiny internal injuries that build up over time. These injuries aren't always painful right away. In fact, most men don't notice them at all until the damage has already been done. Let me explain what's happening inside. Your penis isn't just skin and muscle. It's a complex structure made up of blood vessels, spongy tissues, and smooth muscle fibers. When it's fully erect, it becomes firm enough to support pressure during intercourse. But when it's only partially erect, the internal tissues lack the rigidity needed to protect themselves from friction or bending. That's when these micro-tears can begin to form. Over time, as they heal, they create scar tissue. That scar tissue can pull on surrounding areas, leading to a condition called Peyronie's disease, a painful curvature of the penis that can make sex uncomfortable or even impossible. I've treated dozens of older men who came in late sometimes after years of struggling in silence. Many were embarrassed, unsure what was happening, or afraid it was just a part of aging, but it wasn't. It was preventable injury made worse by rushing the act. Take Mr. Donnelly, for example, a 67-year-old gentleman who hadn't been sexually active for a while and was trying to reconnect with his wife. In his eagerness, he tried to have intercourse before he was fully ready. Within weeks, he noticed a bend, then discomfort, then difficulty performing altogether. He thought he was falling apart, but in reality, he was experiencing textbook symptoms of Peyronie's. The key message here: slow down. Give your body the time it needs to prepare. Use foreplay stimulation. and if needed, erectile aids to ensure full rigidity before intercourse. And always use a quality lubricant to reduce friction. If you're feeling pressure to perform quickly, talk to your partner. Honest conversations go a long way toward protecting your health and preserving intimacy. This isn't about being fragile, it's about being smart. You've worked hard to keep your body functional. Don't let impatience undo your progress. Now that we've addressed this hidden physical risk, let's shift gears and talk about something that doesn't leave scars on the body, but can deeply affect your mind, your desire, and your connection with others. We're talking about the real cost of too much pornography and how to reclaim your natural sense of intimacy. Let's have an honest conversation, man to man. We live in a time when access to adult content is everywhere, just a tap or click away. For many older men, especially those who are single widowed or feeling disconnected, pornography can feel like a safe, private way to keep desire alive. And in moderation, it might not be a problem. But over the years, I've worked with hundreds of men who didn't realize how this habit, done in silence and repetition, was quietly rewiring their brains and stealing something far more important than they expected: true arousal and emotional connection. You see, pornography isn't just visual entertainment, it's a powerful neurological stimulus. It triggers a flood of dopamine, the brain's pleasure chemical, in very specific ways: fast, intense, and solitary. The more we consume it, the more our brains start associating arousal with only those types of stimulation. This leads to a process called desensitization, where real-life intimacy, touch, or emotional connection no longer creates the same spark. You might still want sex, still feel desire, but when you're actually with someone, your body doesn't respond. That's confusing, even heartbreaking. I've had men in their late 60s come to me in tears, saying things like, "I still feel desire, but I just can't perform with my wife anymore, and I don't know why." More often than not, their issue wasn't physical at all. It was mental. Years of relying on porn as a go-to release had slowly disconnected them from real-life stimulation. And there's another side effect. Few talk about shame, secrecy, and isolation. When watching porn becomes a nightly routine, it can replace true closeness. You may find yourself avoiding touch, avoiding conversation, even avoiding your own reflection. That kind of internal conflict builds walls not just between you and others, but between you and your own sense of worth. Now, I'm not here to shame anyone. This isn't about judgment, it's about understanding. If you use porn, be mindful. Don't let it be your only source of arousal. Rebuild your natural arousal system. Use memory or imagination instead of video. Engage in longer foreplay with a partner. Practice breathing and sensation without rushing to climax. Focus on emotional intimacy, not just visual triggers. Reclaiming arousal takes time, but your brain is plastic, which means it can adapt. The more you shift your habits, the more your sensitivity and response will return. And with that, so does your confidence. Because intimacy in your 60s or 70s isn't about trying to be who you were at 25. It's about reconnecting with your body, your emotions, and the person beside you. Now that we've talked about how your brain shapes desire, let's return to the foundation that supports everything we've discussed so far: your lifestyle. Because when it comes to sexual health, what you do each day matters far more than what pill you take once in a while. Let's explore that next. If there's one truth I've learned after decades of working with older men, it's this: your lifestyle determines your sexual health far more than any medication ever will. It's understandable. Most men who walk into my office want a quick fix. A pill, a patch, a shot, something to restore what feels lost. And sometimes medical treatment is appropriate, but too often those solutions are used to mask what could have been prevented or even reversed through daily habits. Here's what most men don't realize. Erectile function isn't just about the penis. It's about circulation, hormone balance, nerve integrity, and mental clarity. And all of those things are driven by how you live your life every single day. Let's talk about blood flow for a moment. Erections depend on healthy blood vessels. But if you're smoking, eating processed foods, sitting for long hours, or drinking heavily, you're slowly damaging those vessels. That doesn't just raise your risk of heart disease, it limits circulation to the areas of your body that need it most during intimacy. In fact, one of the earliest signs of cardiovascular disease is erectile dysfunction. It's not a coincidence, it's a warning signal. Now here's the hopeful part. Unlike aging, lifestyle is changeable. When you stop smoking, circulation improves in just a few days. When you reduce alcohol, testosterone levels can begin to stabilize. When you walk 30 minutes a day, your vascular system becomes more responsive. When you eat foods rich in antioxidants like berries, greens, and omega-3s, you nourish the very tissues responsible for sexual performance. One of my patients, Mr. Kendrick, age 74, came to me frustrated. Medications weren't working the way they used to. He felt sluggish, disconnected from his partner, and ashamed. Instead of prescribing a higher dose, I asked him to give me 90 days. Together, we built a simple plan: daily walking, cutting back on sugar, getting better sleep, and reconnecting emotionally with his spouse. 3 months later, not only was his energy back, so was his confidence in the bedroom, and he was off the meds completely. The truth is, your body isn't broken. It's responsive. It's waiting for you to show up not just once with a pill, but every day with choices that say, I still care. Sexual function is not a separate part of health. It's a reflection of the whole picture. And when you start treating your body with respect through movement, rest, nutrition, and connection, it returns that respect in the form of strength, vitality, and pleasure. Now, before we wrap up, there's one more habit I want to share with you. It might seem small, even trivial, but it can quietly protect you from one of the most painful conditions men face as they age. It all happens while you sleep. Let's talk about what you wear or don't wear to bed. Sometimes it's the simplest habits that have the biggest long-term impact. This one might surprise you: sleep without underwear. It might sound odd or even unnecessary, but after treating thousands of men over 60, I can tell you the way you sleep affects more than just your rest. It can impact your sexual health, comfort, and future performance. Here's why it matters. During sleep, your body enters repair mode. For men, that includes a natural process called nocturnal penile tumescence, in plain terms, spontaneous nighttime erections. These are healthy, vital, and essential for keeping the erectile tissues oxygenated and functional. But if you're wearing tight underwear, especially briefs or snug-fitting pajamas, you could be compressing the penis during these important nighttime events. Over time, that repeated pressure can lead to microtrauma, small areas of tissue irritation, or scarring that go unnoticed until they cause real problems. In some cases, I've seen long-term compression during sleep contribute to conditions like Peyronie's disease, where scar tissue causes curvature pain and difficulty during intercourse. And here's the difficult part: it often develops gradually, so men don't make the connection until the damage is done. Now, this doesn't mean you need to change your entire sleep wardrobe, but simply switching to loose-fitting boxers or sleeping nude allows your body the freedom to move, breathe, and repair the way it's meant to. One of my patients, Mr. Leonard, 71, was dealing with nightly discomfort and mild curvature. He had tried creams, medications, even stretching exercises. It wasn't until we reviewed his daily and nightly habits that we realized he had been sleeping in tight elastic briefs for decades. Within months of making the switch, his symptoms began to ease. Sometimes the fix isn't a medication, it's just a change in awareness. So tonight, give your body that small freedom. Let your skin breathe. Let your circulation flow. You may sleep better and protect your function without even lifting a finger. Now that you've learned all 6 of these essential habits, some physical, some emotional, some surprisingly simple, it's time to bring it all together. Because this is about more than just function. It's about reclaiming dignity, connection, and the confidence to live fully at any age. Let's talk about what it means to age on your own terms. If you've made it this far, I want to thank you. Not just for watching, but for choosing yourself. Because I know that for many men, especially those in their 60s, 70s, or beyond, talking about sexual health can feel uncomfortable, even unnecessary. Society often tells older men to shrink into the background, stay quiet, stay polite, and stop expecting to feel good in their own bodies. But here's the truth. Your relationship with your body doesn't end with age. It evolves. And how you care for it, especially now, matters more than ever. We've covered a lot in this video. From keeping your penis active to maintaining hygiene, protecting yourself during intimacy, limiting overstimulation from pornography, embracing a healthy lifestyle, and yes, even sleeping without underwear. These aren't just health tips, they're acts of self-respect. Each habit you adopt reinforces something deeper: your dignity, your vitality, and your connection to who you are, not just as a man, but as a human being who still matters, still desires, and still deserves quality of life. I've seen what happens when older men reclaim their confidence. They don't become someone new. They reconnect with the person they've always been. They walk differently, speak differently. They laugh more, engage more, and feel more alive. And often their relationships improve not just sexually, but emotionally. Let me be clear. This isn't about chasing youth. It's about owning your stage of life with power, pride, and peace. If you've been struggling in silence, if you've accepted a quiet decline as just part of aging, let this be your reminder. It's not too late. It never is. Start with one thing, one small choice. Maybe tonight you take off the tight underwear. Maybe tomorrow you go for a 20-minute walk. Maybe later this week you have an honest conversation with your partner or doctor. Your health doesn't define your worth, but it does reflect your attention. And when you care for yourself in these simple, intentional ways, that care radiates into every part of your life. So let's keep going together, because you are not too old, you are not invisible, and you are not done. If this message resonated with you, please consider giving this video a thumbs up, sharing it with a friend, brother, or father, and subscribing for more honest, age-positive health advice. You've already taken the first step. Now let's walk the rest of this journey side by side. Thank you for being here. Take care and take charge.